Good afternoon or good morning, depending on where you're calling in from. Welcome. We will get started around the top of the hour, so hang tight and we'll get started in a couple minutes. Hello and welcome to the first session of the ASTO Connect series on brain health. I'm Talia Sands, the Director of Health Improvement at the Association of State and Territorial Health Officials, known as ASTO. ASTO is a national nonprofit organization representing public health agencies in the United States, the U.S. territories, and the District of Columbia, and the over 100,000 public health professionals that these agencies employ. ASTO is a leadership home for state and territorial health officials, an advocate and voice for state and territorial public health, and a capacity building provider for state and territorial health agencies. Within our health improvement portfolio here at ASTO, healthy aging is a public health priority with brain health as a key focus, which brings us to today's first ASTO Connect in our series on brain health. Today's virtual open house will feature national partners and an overview of the Healthy Brain Initiative Roadmap, how it was developed, and current approaches for distribution and implementation. This is the first in a series of 3 sessions about the roadmap, so we hope you'll mark your calendar for our next 2 events, our Conversation and Cup of Joe virtual coffee chat on March 23rd, and our Ask the Experts live Q&A with a variety of experts on May 13th. And we hope you'll participate in the whole ASTO Connect series on brain health. Each session will build upon one another and help prepare you. We'll walk through a variety of presentations today. Following the welcome and introductions, we will provide a brief state spotlight, then talk through the development of the HBI Healthy Brain Initiative Roadmap, discuss implementation at the state level, updates for Indian country, and have some time for Q&A at the end. Next slide. During today's virtual open house, we will hear from the following speakers. First, we'll hear from Sally Pitt, the Director of the Office of Patient Advocacy at the Tennessee Department of Health. We'll then hear from Lisa McGuire, the CDC's Alzheimer's Disease and Healthy Aging Program Lead. Then we'll hear from Molly French, the Director of Public Health at the Alzheimer's Association. And finally, we'll hear from Dave Baldridge, who is the Executive Director of the International Association for Indigenous Aging. We will be using polls and the chat box throughout today's session, so please keep an eye out and stay engaged, and feel free to chat with us if you're having any technical issues. But to get us started, we have a quick poll and ask that you participate by typing in your answer into the chat box. The question is, which frameworks have you heard of for supporting healthy aging or brain health in your jurisdiction? A, CDC's Healthy Brain Initiative Road Map, B, AARP's Age-Friendly States, C, TIFA's Age-Friendly Public Health Systems, or D, Other, and please specify. All right, we see a few comments coming through the chat box. Please keep your answers coming. Great. Thanks for participating, everyone. So we will move along to our first speaker, and we are going to welcome Sally Pitt from Tennessee, in the recognition that states have made quite a bit of progress to date, working on Alzheimer's plans, state health improvement plans with brain health components, and other activities in their jurisdictions to support people living with Alzheimer's and other dementias, as well as their caregivers. So to kick off our event, we invited Sally to talk about her experience using the Healthy Brain Initiative Road Map in Tennessee. Health agencies are a critical partner for families and people living with Alzheimer's disease and other dementias. Last year, Tennessee made a hub of online resources related to Alzheimer's and other dementias that Sally will tell us about today. So Sally, I will turn it over to you.
Thank you, I appreciate that. So first I'd like to begin by sharing the Tennessee Department of Health's interest in brain health. In Tennessee, Alzheimer's is the 6th leading cause of death among those that are 65 and older. Tennessee has the 7th highest Alzheimer's death rate in America, and by year 2030, 28% of our state's entire population will be 60 or older. In 2017, the Tennessee Department of Health conducted a strategic topic session on healthy aging and invited the Alzheimer's Association to brief our key executive leaders on the Healthy Brain Initiative Roadmap and Alzheimer's as a public health issue. This session resulted in our department applying and receiving a small grant from the Alzheimer's Association in partnership with CDC and ASPO to implement at least 2 action items in the Healthy Brain Initiative Roadmap. We believe the identified modifiable risk factors to reduce cognitive decline aligned with our state's 4 identified factors that are driving all 10 of the 10 leading causes of death in Tennessee: physical inactivity, obesity, tobacco use, and substance abuse. Utilizing the Healthy Brain Initiative Roadmap, as you see on the screen, I want to talk about 3 items that we are currently working on. So we developed the 2019 Healthy Aging Brain Brief and Strategies for Action. We compiled and disseminated to our public health professionals state and county level surveillance data describing the prevalence of Alzheimer's and other dementias within our state, including burden, disparities, modifiable risk factors, and impact on service utilization and related costs. The brief provides a collective framework to increase public health's role in the promotion of healthy lifestyles and identifies for our public health professionals ways in which our current work intersects with the risk reduction of Alzheimer's and other dementias, as well as low-cost or no-cost opportunities to integrate cognitive health messaging into our current health education campaigns. Then we will see the Healthy Brain Toolkit for Public Health. So in partnership with our state's Alzheimer's Association, we developed the Healthy Brain Toolkit, which is designed to increase the public's awareness of brain health by providing our public health professionals with tailored tools and resources to integrate brain health messaging, again, into our existing public health programming on physical inactivity, obesity, tobacco use, and substance abuse. The toolkit is being shared with our regional, metro, and county health departments, both electronically and by hard copy. The next item on the screen, we developed the Alzheimer's Disease and Brain Health website within our department's existing website to ensure that our public health professionals have access to evidence-based Alzheimer's disease and dementia-related educational information. The website was designed to be utilized by our department's public health professionals, the general public, and the healthcare community to raise awareness and outreach efforts concerning brain health, Alzheimer's, and other dementias. In addition to the website, I'd like to mention that our department partnered with our state's Alzheimer's Association to develop and conduct a live training webinar to educate our public health professionals on cognitive health, health indicators, the importance of early detection and diagnoses, the role of caregivers, and the burden of Alzheimer's disease as a public health issue. Moving forward, a few of the recommended strategies outlined in the brief have been implemented, including the toolkit, the live webinar training for our public health professionals, and our department's 2019 state health plan will have a healthy aging with a emphasis on brain health component. Also in 2019, as a result of the partnership with the Alzheimer's Association, CDC, and ASTO, we advocated and will be having the 2019 BRFIS, which will include the caregiver and cognitive decline module. We have secured a small amount of funding through our department's Office of Minority Health and Disparities Elimination to work with interested communities to raise public awareness around the importance of brain health across the life course. The Tennessee Department of Health continues to engage the Alzheimer's Association both at the state and national level, and our regional, metro, and county health departments as we move forward with our brain health work. Throughout the Healthy Brain Road Map grant work, we received ongoing technical support from the National Alzheimer's Association and ASTO, which continues to be invaluable in our work moving forward. This concludes my part of the presentation. I will now turn it back over to Talia.
Thank you, Sally. Really appreciate your personal story of what you've done in Tennessee, and I hope those on the line are taking inspiration from you. We're going to move along to our next presentation from Lisa McGuire, who is the lead of the Alzheimer's Disease and Healthy Aging program at the CDC. She is a champion for brain health, healthy aging, and health equity approaches to improve outcomes. Today, Lisa will share background information on how the Healthy Brain Initiative roadmap was developed and opportunities to stay up to date with the roadmap. Lisa, take it away.
Thank you very much, Talia. I wanted to start out today talking first so we have the same base understanding about talking about what dementia is. So when we talk about dementia, dementia is not in itself a disease. Rather, it's an umbrella term for a set of symptoms that characterize the loss of cognitive functioning that can be severe enough to interfere with a person's daily life. We know that there are several different diseases or conditions that can cause dementia, the most common of which is known as Alzheimer's disease. Scientists believe that many, if not most, of the cases of dementia are mixed. That is, that a person may have more than one cause of the dementia. So under the umbrella here, you can see some of the common types or common causes of dementia in the U.S. Next slide, please. So in the United States, Sally told us in Tennessee what the statistics are, but we know in the United States that Alzheimer's disease is the 5th leading cause of death for people aged 65 years old and older, and it is the 6th leading cause of death for all ages. Next slide, please. Some recent CDC analysis have shown have estimated the projection. So we see racial and ethnic differences in the prevalence of Alzheimer's disease. As well, we expect to see nearly a 3-fold increase between 2014 and 2060. Next slide, please. So a few more facts that I want to bring to our attention today for background. So we know that about 35% of people are diagnosed with dementia, and that their caregivers are aware of it. So we know that of those people that are diagnosed, only about 35% of them are aware of their diagnosis, or their caregiver are aware of their diagnosis. So these statistics that I'm going to highlight really resonate with the Healthy Brain Initiative Roadmap, as well as other national priorities such as healthy people. So that first 35%, that is a healthy people objective. So another important healthy people objective that we need to think about is that we know that about 25% of hospitalizations are preventable for people who are older adults that have a dementia diagnosis. So one of the things that we're thinking about through that Healthy People, as well as our roadmap, are what are some of those ways that we can reduce those preventable hospitalizations. A third point that I want to point out is we know that about 45% of people who are having subjective cognitive declines or who believe that their memory has worsened in the past year have actually discussed those concerns with their healthcare provider. And hopefully moving forward in 2030, this will also be a national objective. So these other two statistics on the slide I want you to think about is about 70% of the people with dementia who live in a community setting, they tend to have at least one or more chronic health conditions. So in other words, we're talking about people who, the majority of people with dementia live in a community setting, and the majority of those who are Medicare beneficiaries and have dementia also have another chronic health condition. And when we think about caregivers who are very instrumental in providing support to people who have Alzheimer's disease or related dementia as the disease progresses, we see 1 out of 3 of those caregivers report that their health has worsened due to their caregiving experience. Next slide, please. So as we were developing and revising this new roadmap, we took a life course perspective, which is a little bit different of approach than we have taken in the past. So what we're looking at here on this graphic is we're looking at the life course perspective for a person who is going to develop Alzheimer's disease or related dementia. So in this inner circle here, you can see the stages of the progression from the healthy cognitive functioning, the pre-symptomatic phases, the mild cognitive impairment to dementia. The outer wheel, the blue shading, we can see where public health has an opportunity to intervene. So we can see in the healthy cognitive functioning up through some of the mild cognitive impairment, we see that there's opportunities for risk reduction. We see that through the pre-symptomatic, through the earlier dementia stages, we see there's opportunities for early detection and diagnosis. And then for the mild cognitive impairment and dementia, we can see that there's issues related to quality and care and safety. And so these relate directly to the roadmap action items that will be discussed a little bit later today. So a little bit of history about CDC's Healthy Brain Initiative from a national perspective on this next slide. So the Healthy Brain Initiative was founded in 2005 with support from Congress. In 2007, we published our first roadmap. We were able to add in 2009 the cognitive decline and the caregiver modules in their original iterations. In 2010, we saw that due to a lot of public support, dementias, including Alzheimer's disease, was added to the Healthy People 2020 objectives. 2011, there was a law signed into place for the National Alzheimer's Project Act, which results in national objectives that were identified, and a national annual report that was published for the first time in 2012 and is published annually. The second roadmap was published in 2013, and then in the fall of 2018, we were very proud to release our third roadmap. The next slide, please. So when it came time to revise our roadmap, we identified a variety of different sources. We looked at our roadmap, the second roadmap, which you see there, the blue roadmap, and we looked at the progress. So what objectives have been implemented by states and local public health departments? Which ones really needed additional work? Which ones needed refined? We also looked at the leading public health issues that we anticipate and are aware of for this next 5-year time frame. And we proposed and reviewed actions for the next roadmap, for that third roadmap. There was lots of expert and stakeholder development. There was almost 150 different practitioners, subject matter experts, representatives from national organizations, professional organizations, and a variety of different groups from different walks of life who really could contribute to the development of this roadmap. Next slide, please. You can see on this next slide, which got zoomed a little bit, you can see on the left-hand side, you can see the cover of the new roadmap, roadmap number 3, and on the right-hand side, you can see the essential services of public health represented. So the nice thing about this roadmap is there are 4 domains that are really guided, that the actions all fit into, which are guided by those essential services of public health. And there's 3 core principles that really are aimed at reducing health disparities, collaboration across multiple sectors, and leveraging resources for impact. The center of this wheel is also crucial because it looks at applied research and translated that's truly needed to move science from bench to trench with widespread adoption of effective interventions. So when the roadmap was released, we also developed some other materials to really help those who are working with the roadmap decide where to begin. So the left-hand side you see the document you see on the left-hand side, back where you were, right, shows us the dissemination guide. So it's for ways to help you think about and to promote and discuss the roadmap with your constituents. The right-hand side is if you're thinking about implementing roadmap actions, it's a process to help you think through what your resources are and what your priorities might be in your area to identify the best places to start. The next slide shows the issue maps that are newly released. So these issue maps, there are 3 of them that I'll show you in just a second, but I think this slide is really useful to show you what material is inside. So the full roadmap contains 25 actions that cover a variety of different topics. Your group might be interested in a specific topic, such as caregiving or caregivers. So what this 4-page fold-out document does is shows you on one page what some of the compelling data is in some of the public health issues. The next page shows the specific roadmap actions that are geared towards just the caregiving topic. And then the final page shows some examples that have been used in states to support. The next slide shows us the 3 issue maps that we do have. We have one for caregiving, we have one on risk reduction, we have one on early detection, and we have a couple more of those that are also in the development process. Next slide. The next slide shows some of the data products that have been developed at CDC using the BRFS data. So we heard, and we're very pleased to hear that Kentucky is going to be administering both modules in 2019. But these modules we're glad to hear that they're being used. We really want data to be driving the action. So for our subjective cognitive decline module, which is asking people to evaluate their memory in the past year, as well as asking them how it has potentially interfered with their daily lives, and also ask if they've talked to a healthcare professional, we have these infographics that you're looking at here. We have them for 49 states, DC, and for Puerto Rico. So these are free and publicly available for you to download. The next slide shows you infographics that we have for our caregiving module. So these also are available for each of the states that administer these modules in the Behavioral Risk Factor Surveillance System and overall. So this tells you how many people in your state are caregivers. It also provides information about the intensity and duration of the caregiving situation, as well as some of those actions that are needed. Then we also have a data portal, which is the next slide, which has various public health data and indicators using BRFS data that's geared towards older Americans. The next slide is a preview of our Indian Country Roadmap, which will be available this spring, which is a a modification of the public health roadmap, but it is designed for Indian country. And last, thank you very much. We greatly appreciate your interest in the public health roadmap and implementing it in your state, locality, or territory or tribe. We all know that Alzheimer's disease is very costly and affecting millions of people. We know that there's an opportunity for public health to act, and we hope that this roadmap will help stimulate and chart the course for your specific area. Thank you very much. I'll turn it back to Talia.
Thank you, Lisa. Check the chat box for a link to sign up for email updates that Lisa mentioned. So we'll transition now into hearing from Molly French about implementation of the roadmap at the state level. Molly is the Director of Public Health at the National Alzheimer's Association, and she is a strong advocate for brain health and state and local public health champions. Today, she'll share key updates about the roadmap, along with opportunities for further engagement through the Alzheimer's Association. Molly, I'm turning it over to you.
All right, thank you. And thanks so much to everyone who's listening and letting me share the Alzheimer's Association's great enthusiasm for the new roadmap. This has the most needed and practical steps public health agencies can be taking so that they can start preparing communities for the growing challenges and costs of Alzheimer's. So I will be giving you just a sampling of the actions in the new roadmap that are recommended for state and local public health agencies and their partners. And then going beyond the wonderful example of Tennessee to talk about how other states have used the roadmap to begin that process towards a dementia-prepared future. Next. As Dr. McGuire explained, the roadmap is grounded in 4 of the essential public health services. In the monitor and evaluate domain, one of the recommendations, as you've been hearing hints of, is to conduct surveillance using both of the behavioral risk factor surveillance system, or BRFSS, optional modules. There's one for cognitive decline and another one on caregiving. And we're just so delighted that in close partnership with CDC and states' BRFSS coordinators, we've begun striving to build a nationwide database of surveillance data from use of the cognitive decline module. The purple states, we wanted to give a big thank you for them. They are using the cognitive decline module in their 2019 BRFSS. And in the gray states, our chapter policy staff will be approaching the state departments of health there, asking for their support to use the cognitive module in the 2020 BRFSS. Next, please. So similarly, with CDC and the BRFSS coordinators, we wrapped up about a year ago extensive collection of caregiver surveillance data using the caregiver module. These show the 47 states, DC and Puerto Rico, who use the module in their 2015, 2016, or 2017 BRFSS. And I do want to say that both at the national level and at the state level, the Alzheimer's Association, we do extensively use the data on cognitive decline and caregiving in our work, and we certainly encourage our public health partners to do the same. Next. Another roadmap domain is assuring a competent workforce, and the roadmap does recommend that public health agencies develop the knowledge of their workforce on Alzheimer's. And toward this end, we do have faculty in schools and programs of public health you've been using a curriculum that we developed in partnership with CDC and the Emory Centers for Training of Technical Assistants. And faculty are using this, this four-module curriculum to teach their students about Alzheimer's. It is a free resource, ready to use for any public health partner. It can be adapted, used in whole or in part with your coworkers. and it teaches the basics of Alzheimer's and the public health role. Next, please. So as Sally had mentioned, Sally Pitt, with ASTO and with support from CDC, we are really pleased to have been able to support 2 groups of state public health agencies with their efforts to implement the Healthy Brain Initiative Road Map. I'm going to highlight a few of the many other models that they have generated. So one is from the Minnesota Department of Health. They recognize that people living with Alzheimer's do have special oral health challenges, and that community health workers were ideally suited to helping be part of that solution. The department partnered with the Training and Education Institute for Community Health Workers to prepare these professionals to help caregivers and other providers in the community better care for the oral health needs of people living with Alzheimer's. Next. Out west in Utah, the Department of Health there really has been on the part of the cutting edge of states with multiple component efforts, and they've had a focus on increasing early detection of Alzheimer's. And one part of that is, how can we equip primary care providers, particularly physicians, to detect and diagnose Alzheimer's? So as one part of this initiative, the Utah Department of Health partnered with Health Insights, which is a quality improvement organization, to better understand what primary care providers were doing during the Medicare annual wellness visit and the extent and how they were assessing cognition as part of that. Then the Utah State Health official, Dr. Miner, he issued guidance to primary care physicians in the form of a Dear Colleague letter, and then the department also produced a companion tip sheet, to guide primary care providers in assessing cognitive health, and then, moving them through the diagnosis process, and also knowing how to refer patients who had memory problems or dementia, mild cognitive impairment to resources within the state. And this guidance then was followed by some education and training. Next, please. Jumping to another essential public health service, that of policies and partnerships. One roadmap action is to increase adoption of effective interventions and best practices. Dr. McGuire talked a little bit about this. In Louisiana, the Department of Health knew that even small changes in workplace supports for caregivers could make a difference with retaining valuable employees, especially those caring for someone living with Alzheimer's. So they created this online training module for department supervisors and leaders on, policies and practices that can help team members sustain their vital role both within the department and on the job, as well as caregivers in their private lives. The Louisiana Department of Health also made this training module available to employees and other state agencies. So getting that bigger ripple effect. Next, please. Engaging and empowering the public is a long-standing essential public health service. And likewise, it is a cornerstone of the Healthy Brain Initiative Road Map. So one way that this has been acted upon, the Missouri Department of Health and Senior Services, they wanted to encourage people to use available resources for dementia. They're available to people living in homes and community settings. First, they decided they couldn't target the whole state, so they used their data to identify an 8-county region in the southeastern part of the state that had a higher risk for cognitive decline. And then they partnered with the Alzheimer's Association chapter to conduct a multimedia marketing campaign that encourages people dealing with Alzheimer's to get information and support that is available. Next, please. The evidence does continue to build and grow that there are ways to reduce risk for cognitive decline. And the roadmap certainly encourages public health agencies to make sure the public knows what the best ways are to protect their brain health. In South Carolina, the Department of Health and Environmental Control chose to educate the public about the heart-brain health connection. They conducted a multi-layered campaign in collaboration with the Eat Smart, Move More Collaborative and our Alzheimer's South Carolina chapter. This entailed getting out basic messaging through radio PSAs, partnering with a historically Black university to send out postcards to their alumni, driving folks to the department's website, which had a new microsite here about taking brain health to heart. You can see the image here, and which had a call to action of pledging to live a more heart-healthy, brain-healthy lifestyle. Next, please. As Alzheimer's progresses, people living with dementia, caregivers, families, they are going to encounter many new challenges. Some of these will be unexpected. In Washington State, the Department of Social and Health Services, in partnership with the Department of Health and other partners, created this Dementia Road Map to help all people who are affected better plan for the changes ahead and know what kinds of information and assistance is available to help them. Next, please. So these, as I said, are just a small sampling of what different public health agencies across the country have done with the roadmap. We do encourage you to visit our website, ALZ, or alz.org/publichealth, where you can find data, tools, and other resources, like some of these featured, but many more. And this will help you if you come, do some browsing. It will help you with implementing the roadmap. Next, please. So on a related note, it is related, but switching gears a little bit, certainly for decades, state, local, and tribal public health agencies have worked in tandem with CDC and achieved remarkable gains in tobacco, HIV/AIDS, injury prevention. And a new law that was signed by the President on December 31st aims to replicate the success in the world of Alzheimer's, on the issue of Alzheimer's. So this new law, the Bold Infrastructure for Alzheimer's Act, was bipartisan legislation, and it authorizes CDC to create an Alzheimer's public health infrastructure across the country, with three primary components. So one is establishing Alzheimer's public health centers of excellence. Another is providing cooperative agreements to public health departments. And then third is increasing data collection, analysis, and timely reporting. And I do want to emphasize that this is authorizing legislation, so it's part one of a two-part process. There are advocates working with members of Congress to address the funding need in FY20. Thank you very much.
Thank you, Molly. Wonderful. We have a final presentation from Dave Baldridge, who is the Executive Director of the International Association for Indigenous Aging. He is a longtime champion for improved health of Native elders. Today, Dave will share with us key strategies used to develop the Healthy Brain Initiative Roadmap for Indian Country. Dave, I'll turn it over to you.
Thank you. Next slide, first slide, please. Thanks. I'd like to welcome my colleague, Jolie Crowder, who I hope is joining us for the call, and she would be also very welcome to respond when we have comments. And Molly, thanks for your leadership in the project that I'm about to describe. I also have a longtime colleague and friend, Dr. Mario Garrett, a psychology professor at San Diego State University. I consider him to be the nation's foremost demographer on American Indians and Alaska Natives, and he has often clarified things for me. He once told me, "Dave, your life is simple. No matter where you go and what the situation, you only need to ask one question. What about the Indians?" And that's pretty much been the story of my career. So here I am again asking you the same question. Next slide. Public health initiatives are difficult to incorporate into Indian country because of the huge diversity. We have 567 federally recognized tribes who speak more than 100 languages, although I'll speak English. The tribes range from the Arctic Circle to the Florida Everglades, and range from a dozen or so Alaska Native village residents to 500,000 members of Cherokee Nation. The tribes range from those North Slope villages who may not have reliable fresh water or solid waste disposal to the Massantucket Pequots who have their own pharmaceutical company. Chickasaw Nation in Oklahoma owns their own private jet on which they fly to South Korea to do business. Next slide. One of the poorer tribes in the nation is the Havasupai, who live in the bottom of the Grand Canyon. In 1989, members of this small, impoverished tribe of 650 or so people approached an Arizona State University anthropology professor with whom the tribe had a pre-existing and trusting relationship. They were seeking to learn why the incidence of diabetes within their community was increasing. And the ASA researchers determined that no genetic link to diabetes existed, but the researchers continued working into medical disorders without seeking additional consent from the tribe. Other ASU researchers also utilized the Havasupai samples for their work, and then published papers about inbreeding, alcoholism, and the origin and migration of the tribe from Asia. The terms of the settlement were a payment of $700,000, the return of the blood samples, and additional assistance to the tribe. The Havasupai experience demonstrates the extensive harm that can be done to a community, some of it irreparable, through violation of informed consent. That incident virtually stopped outside research participation by tribes across the nation for several years. Next slide. Today, many tribes may be just fine with research as long as it's participatory. Designated by Congress as quasi-sovereign nations with similar authorities to states, tribes own and control the release of their own health data. Most research projects are now subject to tribal IRBs. And even if research is not involved, and it was not in our work, a participatory approach as it relates to behavioral health means that the tribe has to be a significant collaborative partner at every step, not just in the implementation of projects designed from the outside. Next slide. With this approach in mind, our IA2, International Association for Indigenous Aging, our team produced 2 webinars last year under Molly's direction for the Alzheimer Association, designed to inform the upcoming roadmap for Indian country. One of our webinars was for tribal health directors, one for senior program or Title VI directors. The process was for us extremely difficult. Lists of tribal health directors are not made available by the Indian Health Service. So we placed more than 100 phone calls to key contacts and sent as many emails just to recruit participants. Next slide. We were careful to pose our webinars as consultative, not informational, and that's how we conducted them, with lots of time set aside for discussion. We made our presentations using 2 highly respected native Alzheimer's experts, J. Neil Henderson, head of the Wisdom Keepers Project at the University of Minnesota Duluth, and Dr. Blythe Winchester, a physician with the Eastern Band of Cherokee Indians in North Carolina. Next slide. We distributed invitational flyers to several hundred tribal health directors and more than 200 tribal senior program directors. Next slide. Our approach resulted in a high response rate. Participants contributed significant insights on the phone with us and in their responses into the challenges that they faced with Alzheimer's and related dementia locally. Next slide. In our report for the Alzheimer's Association, the interface with public health takes place after the webinar completion. This was the responsibility of Molly, who headed the project. To incorporate the public health perspective and distill it from a number of personal interviews is no small task, but we were delighted with the results. And because we included them as equal participants, we were also delighted with the level of responses that we received. Next slide. To be effective for the Healthy Brain Initiative, the analysis had to bridge the gap between community input and public health objectives. Next slide. The results now require careful dissemination plans on our part and on everyone's part. Our job is to get the HBI to Indian country in effective, usable ways. Thank you very much. We're very honored to have been part of the project to date.
Wonderful. Thank you so much, Dave, and to all our presenters for sharing with us what the Healthy Brain Initiative Roadmap is, the ways that it's been put into action, and how we can look forward to the roadmap for Indian country. With that, I will turn it over to my colleague, Kelsey Donnellan, Analyst for Health Improvement here at ASTO, to guide us through some time for questions. So think of your questions, type them into the chat box, but to get us started, she has a quick poll.
Yes. To get us started in the questions, you can use the chat feature, or you can unmute yourself and ask them by audio. In the chat box, you'll now see the question that is also on the screen, excuse me. What action category from the Healthy Brain Initiative Roadmap do you think is most urgent in your jurisdiction? You can choose A, educate and empower, B, develop policies and mobilize partnerships, C, assure a competent workforce, and D, monitor and evaluate. Wonderful. We see some coming in through the chat box. As you continue to think, again, you can use the chat box to answer our poll and to ask questions. You can also ask them by audio by unmuting yourself. Well, as we wait for more responses to the poll to come in, I do have a question for the presenters, Lisa, Molly, and Dave. Please feel free to chime in. What is one key step that state health agency staff can take between now and the next ASTO Connects in this series to take the HBI roadmap into action?
This is Lisa, and I'll start. I would encourage people to visit CDC's website, so cdc.gov/aging, and to look at our roadmap page and look at the variety of materials that are there. And keep checking back because more information is being added. And the same thing I know on my colleague Molly French's website on alz.org/public health, I believe that's right. And also check out the implementation, the planning implementation guide on our both of our websites. Molly?
Oh, well, Lisa, Dr. McGuire, that was what I was thinking. So certainly, kind of going to the websites and browsing, see what has been done, getting data. That sounds like a wonderful first step.
This is Dave. It would be very reasonable as a first step to determine exactly what tribes are located within your jurisdiction, your state, and ways to approach them are widely available. So that would be a good start. Just identify who you've got for Indian country, and we could all go from there.
Thank you. Speaking of interactions with other partners, Molly, can you help us understand how public health agencies can engage with the Alzheimer's Association chapters?
Sure. Thank you, Kelsey. If you go to our website, to alz.org, there is a way to navigate to find your local chapter, or you just type in your, Alzheimer's Association in your state. And most of our directors of government affairs, of public policy, are willing and able, be thrilled to reach out and start talking with you about partnering.
Thank you, Molly. And I'll pause to see if there are any questions on the line or in the chat box. Great. Well, I do have a question. Dave, you mentioned a moment ago that the strategies were widely available for engaging with tribal communities within the state. How would you recommend a state contact the tribe, or where should they start looking for some of those strategies?
That's a very good question. Tribes do not tend to operate as pure democracies. They are governed and led by their elected tribal officials, the tribal council, and their tribal leadership. Most certainly, any initiative that goes through a tribe involving behavioral health or any other health issues really needs the support of that group of leaders, the tribal leader and the tribal council. And their, not individual names, but their addresses are absolutely very reachable and very available. They're easy to find on the internet. Just Google a tribe. But I would start with the tribal leadership. And if you can get their buy-in, it will ease every step of everything else you'll want to do with them.
Great. Thank you so much, Dave. That's helpful insight to start with the tribal leadership. And Lisa, I have one more question for you as well. What would you say are some of the actions that are ripe for implementation at the state level? So going into a little bit more detail there.
Thank you, Kelsey. Well, on our executive summary for the roadmap, which is available at cdc.gov/aging, we have marked those that we think out of those 25 that are the most ripe for implementation that fit into the different categories: the educate and empower, the develop policies and mobilize partnerships, assure a competent workforce, and monitor and evaluate. So we have 10 of those identified, and utilizing the planning implementation guide, we encourage you to think through what some of the needs and priorities are for your locale, and to help move forward with those. So there are 10 identified, and they fit into all the categories, because one of the questions that we usually get is, where do we start? We don't have resources. We don't have, we can't do all 25 of these, but we've tried to think through what are some of the lower hanging fruit moving forward.
Thank you. I think that's an important piece, is to go for what is the lowest hanging fruit and also gain momentum and build buy-in.
And then to add to that, Lisa, those that are also going to be the most impactful for your area.
Yep. We have a few more minutes with these wonderful experts on the line. So if you have any questions or comments that you'd like to share with us, please do so in the chat box or on the phone if you unmute yourself.
All right, well, hearing none, we will move on to share with you a bit more about the upcoming events in the ASCO Connect series. But if you do have questions, please do feel free to type them in the chat box or contact us at ASCO. We'd be more than happy to find you an answer or connect you with the person or resources that are needed. Thank you as well to our speakers. Really appreciate you all sharing your time and your insight with us. And kicking off the first ASCO Connect webinar in this series. We welcome you to join for our next two events as shared earlier. We have our Conversation and Cup of Joe coming up on Monday, March 25th. And we want to invite you to that to dive a little bit deeper into some of the state efforts to implement healthy brain and Alzheimer's disease and program initiatives in their jurisdictions. You'll have the chance to share your questions live with the speakers, so please tune in for that. And then we have our Ask the Expert session coming up on Monday, May 13th. That session will involve experts from national and state levels, and we'll ask for your questions ahead of time so that we can prep the speakers to address the things that you're interested in, and really getting into the nitty-gritty of specific ways that you can incorporate brain health, the Alzheimer's disease, and caregiving content into your programs in your jurisdiction. So get excited for that, and also turn your attention to the chat box where you can find the registration links for those two events. In addition, we value your feedback and input on our ASCO Connect events. So please take a moment to complete the evaluation survey. That is, the URL is on the screen, and the survey link will pop into the chat box shortly. Please do take a few moments to share your feedback. It's a very quick survey, and it will help us improve our ASCO Connect events for the rest of this series, as well as across other ASCO Connect programming. So with that, I want to thank you all for your participation, welcome you to join for our next two ASCO Connect in this series on brain health, and thank you again to our wonderful speakers and for your time and insight. Thank you, and have a great day.